Picture this. You're at the park. Your 18-month-old is playing in the sandbox, and another mom casually mentions her child is already speaking in sentences. Your heart sinks. Your baby barely says 5 words. You smile and nod, but inside, panic is rising. Is something wrong? Should you be worried? Here's what nobody tells you. That comparison you just made might be completely meaningless. But there are 7 subtle signs that actually matter, signs that even some pediatricians miss during routine checkups. And ignoring them could mean missing a critical window for early intervention. What if I told you that the milestone chart you're obsessing over might be causing unnecessary anxiety, while the real red flags are hiding in plain sight during everyday moments at home? In this video, I'll reveal the 7 developmental signs you should actually be watching for, the dangerous milestone myths that are making parents panic unnecessarily, and exactly when to worry versus when to wait. By the end, you'll know the difference between normal variation and genuine concern, and you'll never look at your baby's development the same way again. Before we dive in, if you're a parent who wants to feel confident about your child's development without constant anxiety, this video is for you. Hit that like button, subscribe, and turn on notifications so you never miss crucial parenting insights. Because this information could change everything. I know you're exhausted. I know you're trying so hard. You read every milestone chart. You compare your baby to others at playgroup. You lie awake at night wondering if that speech delay means something serious or if you're just overthinking. And here's the thing. You're not alone. Millions of parents are caught in this exact spiral of anxiety. The internet tells you to trust your gut, but then fills your feed with terrifying stories. Your pediatrician says, let's wait and see. But that gnawing feeling won't go away. Here's what nobody tells you. The milestone system we all rely on was never designed to account for the massive range of normal development. Boys develop differently than girls. Bilingual children hit language milestones differently. Temperament affects how skills emerge. But somewhere along the way, we started treating these guidelines as rigid rules instead of flexible frameworks. The scary part? This confusion works both ways. Some parents panic over completely normal variations, while others miss genuine red flags because they were told every child develops at their own pace. So let's cut through the noise. Let's talk about what actually matters, what science really shows, and how to tell the difference between different timeline and needs evaluation. Because when it comes to your child's brain development, knowledge is power, and timing can be everything. Imagine this. Your 15-month-old is building blocks, focused, intent, barely looking up. And somewhere in the back of your mind, you remember reading that poor eye contact equals autism. Here's the truth most people get wrong. Eye contact isn't a simple yes or no red flag. It's about context and quality, not quantity. Research shows that neurotypical children naturally vary in eye contact based on temperament, culture, and even birth order. A focused, independent child might make less eye contact during play, but still lock eyes when showing you something exciting or seeking comfort. The real red flag isn't less eye contact. It's absent reciprocal gaze. Here's what that means. Does your child look at you to share joy? When they find something fascinating, do they look back at you as if to say, "Are you seeing this?" Do they check your face when uncertain? If your 18-month-old never uses eye contact to connect, share excitement, or seek reassurance, that's worth discussing with your pediatrician. But if they're just absorbed in play, that's often just personality. The better approach, watch for shared attention, not just eye contact duration. Are they bringing you into their world visually, even briefly? That connection matters more than constant gazing. Your daughter's friend is reciting the alphabet at 20 months. Your son barely says mama. Cue the panic. Here's what pediatricians don't always emphasize enough. Boys genuinely do tend to talk later than girls. Studies confirm this isn't a myth. It's neurodevelopment. Girls' brains often develop language centers faster, Boys may focus more on motor skills first. But here's where it gets concerning, using gender as an excuse to ignore legitimate delays. The red flag isn't talking later. It's about comprehension and communication attempts. By 18 months, even nonverbal children should understand simple instructions, respond to their name consistently, and communicate through gestures, pointing, waving, nodding. If your 2-year-old has fewer than 25 words and shows limited understanding of language, and doesn't gesture or try to communicate nonverbally, that combination warrants evaluation, regardless of gender. The solution: focus on receptive language, what they understand, and communication intent. Are they trying to connect? Rather than just word count. A child who babbles expressively, gestures, and comprehends instructions is communicating, even without clear words yet. At the 15-month checkup, the pediatrician asks, "Is she walking yet?" She's not. They say, "Let's give it another month." Picture this scenario playing out in thousands of homes. Parents watching the calendar, anxiety building, wondering if those extra months matter. Here's the truth. The walking window is genuinely wide. Anywhere from 9 to 18 months is considered normal range. But here's what matters more than the exact month: the progression. Research shows that children who walk later aren't less intelligent or coordinated long-term. However, lack of motor progression suggests something worth examining. The real red flag: a child at 15 months who isn't cruising furniture, pulling to stand, or showing interest in mobility. It's not the absence of independent walking. It's the absence of the journey toward it. What you should see by 15 months: pulling up on furniture, cruising while holding on, maybe standing briefly alone, strong interest in reaching distant objects. If those building blocks are present, late walking is usually just timing. Instead of obsessing over walking date, watch for muscle tone. Do they feel floppy or overly stiff? Motivation to move, balance when supported, and whether they're progressing week by week. When to worry: if there's no progression toward mobility, if one side of the body seems weaker, or if the pediatrician notes concerning muscle tone. Then push for evaluation sooner rather than later. This one surprises most parents because it seems so subtle. Your 18-month-old is playing with trucks. You call their name from across the room. Nothing. You call again, still absorbed. You walk over and touch their shoulder. Then they respond. Most parents think they were just focused. Kids tune things out. Here's what's really happening. Response to name by 12 to 15 months is one of the most reliable early indicators of typical development versus potential autism or hearing issues. Studies show that children with autism often show reduced or inconsistent response to their name as early as 12 months, long before other signs become obvious. This isn't about hearing. Their audiologist test comes back normal. It's about social orientation. Neurotypical children, even highly focused ones, typically pause or glance when hearing their name, especially by the second or third call. It's an instinctive social response. The test: call your child's name 3 times while they're playing, not during a tantrum or when overtired. Do they respond by the third call? Even a brief glance counts. If this consistently doesn't happen after 15 months, mention it to your pediatrician. Here's what to watch. Are they responding to other sounds? Do they turn when they hear a favorite song or the treat bag rustling? If yes, hearing is likely fine. The issue is social responsiveness to their names specifically. The solution isn't to panic. It's to document and evaluate. Sometimes it's as simple as chronic ear infections affecting hearing during a critical window. Early hearing tests rule that out. If hearing is fine, but name response is absent, early intervention assessment can make an enormous difference. At 14 months, your baby hands you toys, drops them in your lap, but never points at things across the room. Most parents don't realize this matters, but pediatric researchers consider pointing one of the most significant developmental milestones for social communication. Here's the thing: pointing isn't just about showing you something, it's about shared attention, the foundation of all social learning. When a baby points at a dog and looks back at you, they're saying, Are you seeing what I'm seeing? Let's share this experience. Children who don't point by 16 months, especially if they're also not waving, clapping, or using other gestures, may be showing early signs of social communication challenges. The red flag isn't just absent pointing, it's the absence of any gestural communication. No reaching toward desired objects with intent, no showing you things for your reaction, no waving bye-bye or nodding yes, no. What to do instead? Model gestures constantly. Point at objects and name them. Wave enthusiastically. Clap during songs. Create opportunities for your child to gesture back. But if by 18 months there's minimal gestural communication despite modeling, mention this to your pediatrician. This is one of those subtle signs that matters more than many people realize. Your 20-month-old lines up cars, all of them, in perfect rows, every single time, never drives them, just lines them up. You think, they like organization? That's fine. Here's what developmental specialists watch for: rigid, repetitive play without variation or imagination. All toddlers go through phases of repetitive play. Stacking blocks repeatedly. Opening and closing doors. This is how they learn cause and effect. But neurotypical children naturally expand their play. They stack blocks, then knock them down. They line up cars, then crash them. They vary the pattern. The concerning pattern: play that's exclusively repetitive, resists variation, and shows no pretend element by 18 to 24 months. No feeding dolls, no pretend phone calls, no vroom vroom with cars, just lining up spinning wheels or sorting by color with rigid insistence. Research shows this type of play rigidity is one of the earlier observable signs of autism, often appearing before language delays become obvious. The solution: gently introduce variation, join their play and model different actions. But watch their response. Do they eventually imitate and expand? Or do they rigidly return to the exact same pattern every time? If play remains exclusively rigid and repetitive by age 2, despite modeling and encouragement, that's worth professional evaluation. Not to label your child, but to potentially access helpful support services. This is the one that should never be ignored, yet sometimes is. Your 18-month-old was saying 10 words. Over the next 2 months, they stop. The words disappear. Or they were making eye contact and responding to their name, and gradually, they don't anymore. Here's what you need to know. Skill regression at any age requires immediate evaluation. This isn't about bad days or temporary setbacks. This is about skills that were present for weeks or months, then vanish. While development isn't perfectly linear, children often pause progress in one area while mastering another. Actual loss of previously established skills is a red flag that needs professional assessment promptly. Studies show that some children with autism show this pattern, developing typically until 15 to 24 months, then regressing. But regression can also indicate other issues: severe chronic ear infections, lead exposure, metabolic conditions, or even extreme stress. What to do? If you notice genuine skill loss lasting more than 2 to 3 weeks, don't wait for the next scheduled checkup. Call your pediatrician immediately. Early evaluation matters enormously. Trust this instinct. Parents who report regression are almost never overreacting. You know your child. If skills they had are gone, that's worth urgent investigation. Here's what matters most, and I need you to really hear this. Development isn't a race, but it is a journey. Every child follows their own timeline within a range. But within that range, certain patterns matter, certain progressions matter, and certain red flags should never be ignored just because every child is different. You don't need to be perfect. You don't need to catch every milestone on schedule. But you do need to be observant. You need to know the difference between personality variation and developmental concern. The most important thing you can do isn't compare your child to others. It's watch for progression in your child. Are they building skills month by month? Are they communicating somehow, even if not with words? Are they connecting with you socially, even if not constantly? If the answer is yes, breathe. You're likely fine. If the answer makes you hesitate, trust yourself enough to ask for evaluation. Because early intervention, when needed, works. And it works best when started early. Now I want to hear from you. Which of these 7 signs surprised you most? Or better yet, has your child shown any of these patterns? How did you handle it? Share in the comments. Your story might help another parent feel less alone or give them the courage to seek evaluation when needed. We're all in this together. So here's what you've just discovered: the milestone charts. Everyone obsesses over miss some of the most important signs. Eye contact matters, but context matters more. Speech timing varies wildly, but comprehension and communication intent don't. Walking deadlines are flexible, but motor progression shouldn't stall. Pointing, gesturing, play patterns, name response. These subtle signs often matter more than the big, obvious milestones everyone watches. And skill regression? Never wait on that one. Ever. This isn't about creating more anxiety. This is about channeling your worry into useful observation. This is about knowing what actually matters so you can stop panicking about everything else. Now you know. You can't unknow it. Which means you get to choose differently starting right now. Watch with purpose. Document with clarity. And trust yourself enough to speak up when something feels off. If this video helped you, even with just one insight, please hit that like button and subscribe. Share this with other parents who need to hear it, because this information could genuinely change someone's trajectory. Drop a comment below. Which milestone myth has caused you the most stress? Let's talk about it. And remember, this video is for educational purposes only, and does not replace medical advice from your pediatrician or child development specialist. When in doubt, seek evaluation. You will never regret getting your child assessed. You might regret waiting. You've got this. Trust your instincts, know what to watch for, and remember, your awareness is your child's greatest advantage. See you in the next video.